Whoa.
Tiff and I were just talking about this picture, right? Look at this side by side. It's a before and after. Honestly, would you think it's even the same woman?
No, I would
Her
not.
profile has changed so dramatically that it almost looks like, I think, two different people. Not just younger, but truly different.
Yes,
right? And
yes.
so much improved. That's beautiful. And today we're going to talk about the aging face and things you can do if you want to change the pace. Oh, I wrote that. It rhymed. I didn't even realize that.
I didn't think about that one, huh?
We're going to talk about simple treatments with no downtime and things a little more involved with dramatic results.
Yes, that's right. Dr. Andrew Campbell is a facial plastic surgery and owner of Quintessa Aesthetic Centers. Good to see you, Dr. Campbell.
Hi, thanks for having me.
Good morning.
It's been a little bit. I think you see a picture like that and you think, holy smoke, is that the same person? And that's what you do. You specialize in the aging face and techniques that can change the pace, like Molly said.
Yeah, I mean, it's nice because I've kind of molded my practice into just an aging face practice. So I do a lot of eyelids, I do a lot of lower facelifts, and we have a team of experts that do kind of everything else. So from Botox and filler, I have nurses that do that. We have nurses that do lights and lasers. We have specialists that are just for the skincare. I have partners that do body work, and I specialize in the aging
boobs
face.
and butts?
Yeah.
And tummies and thighs
Yep.
and all
You're
the
the
things.
face guy, though.
I'm the face
Right?
guy. Yeah.
What about the aging face? Because I notice it when I look in the mirror, but there's a lot of stuff going on that I think, oh, it's just like, oh, it's the skin damage I had and other things like that. But part of it is a normal part of the process.
I will tell you that the longer I've done this, the more I realize that almost all of it is genetic. So as much as people try to prevent the signs of aging, they really can't. It is obviously sunblock is important. You can prevent skin cancers and things like that. But even people that have been really good with the sun can have early wrinkling, and it's just genetic. And others can beat their skin up and still look great into their 50s and 60s. So, you know, this is all about making somebody look the way that they feel. You know, I have had so many patients come in and literally say they're kind of startled by their appearance. They'll see their reflection in a window or something, and it's like, that's not me. And it's not who they. Well, yes, photos.
Photos
absolutely.
tell the truth. Like that's when you're really like, do I look like that?
Yeah. And then they're going, well, that's not who I think I am. That's not who I feel like I am. And so they come in and we discuss what we can do to basically make them look the way that they used to. And some things are really easy. You know, the Botox and fillers have been around a long time. No downtime works well, but only can do so many things. And then you get into things like the thread lifts. The newer ones are really neat. So,
well, talk about the difference,
Sure.
these before and afters, because there's certain kinds, right? There's thread lifts, there's vampire lifts, there's other things that compare or don't compare to facelifts that you do.
Right, so the vampire lift is really kind of a filler with some PRP, which is a blood product, and it can help skin. You know, thread lifts are going to lift a little bit. They're not going to lift like surgery, but if somebody isn't ready for surgery, these threads can work really well, and these new ones dissolve over time. They actually create a lot of collagen around them, so they actually add volume, and they can lift, and they're
So you're
done.
putting a thread in their face?
Yeah.
Oh.
Yeah. You literally just make a few little spots. You have to mark them really carefully. You numb it, just the spots you're going in, and you pass these threads that are clear. They have little cones on them to engage the tissue. And you come out down here, you come out down here. You actually went in the middle, and then you kind of tuck the tissue so that you get a little lift. It's for the early person that just needs a little bit of lift. It's going to be temporary. So you're looking at something that's maybe a 1.5 to 2 year longevity. Now you could do it again. You're talking in a price range of $2,000 to $5,000, so it's not inexpensive.
Yeah.
And then you get into the things that I do surgically, and most of what I do, I just do right in the office. So patients are awake. We're just using local anesthesia.
Yeah.
And we do these surgical lifts, which are very similar to what most surgeons are doing in an operating room. So these are real long-lasting, very natural looking. That's a huge key. I'm not doing anything that makes somebody look unnatural. I'm not pulling on skin. So you can get these wonderful results. And honestly, nobody really realizes what they've had done, because they just look great and they look natural.
They
so
look
you're
refreshed.
not noticing. Yeah.
Right.
Yeah.
Now, if someone is interested in pursuing something a little bit more like surgery, where they want a more dramatic result, and some of these pictures are just incredible, that's something you can talk through with them and talk about what's reasonable for them to expect.
That's incredible, that picture.
What's awesome is we've got the full spectrum of everything. Like I said, from Botox and fillers all the way up to very advanced surgical techniques that I would then do in an operating room. So sometimes I'm doing a brow lift with upper lids, lower lids, fat grafting,
That's amazing.
deep plane, lasers, all these things. This is just things that that before and after was done in the office.
And what
So
was
it's just a
done,
simple
what did she have
procedure.
done?
It's basically a lift on the sides and tightening under the neck.
That's
and I
it?
just do it, it takes a couple hours. It's in the office.
And she's not put under?
No.
Or she was?
No. No, just local anesthesia. She's awake. Most of the time we're having conversations, you know,
Yeah.
about kids and stuff while we're working.
What's the downtime on something like that?
So we'll wrap them overnight with a bunch of gauze. They go home, they sleep a little elevated. The next morning they take their gauze off and they can jump in the shower.
Nuh-uh.
So, yeah. So if people are just doing the mini, which is very
Is that
common.
what you call that? Is a mini?
That's what I'll call a mini, yep.
Okay.
So if they're doing the mini without doing anything to the neck, which is very common, and they had hair like both of you, you could literally go out the next day because your stitches
would
would all be
cover.
covered.
Wow.
It kind of surprised
amazing.
me. The longer I've been doing this, the more patients that have actually gone to work the next day.
Yeah.
And I just had no idea that was possible.
Yeah.
Wow.
It's pretty cool.
That's
Oh my
amazing.
gosh. Wow,
Is there
you're the best.
fat removal with that?
Sometimes,
A
yeah,
little
if they
suction?
need it,
Okay.
yep.
Okay.
Absolutely.
Wow. Here are your locations. It's Delafield, Madison, Mequon, Middleton, and Sheboygan. 1-800-499-4309. You can find out more about plastic surgery solutions with Dr. Campbell, and to schedule a consultation, go to myquintessa.com or call the number on your screen as well. Thanks for being here, Dr.
Thank
Campbell.
you so much.
Thanks.